how do you structure the people, the teams, all the groups that might need to be pulled together to make all of this work happen? One of the biggest concerns that I hear is, do we need to start creating a bunch of new committees for this? And my answer is no, not necessarily. Maybe. So my recommendation is to really start by looking at the structures that you already have in place. Are there already councils or task forces or committees that are already working on things like your quality metrics? For example, you might already have shared governance councils that could actually tackle some of the frontline nursing engagement or some of the shared decision-making stories. And then there already are probably likely departmental meetings that are taking place that could help you align on some of the HR-related data or some of the patient experience initiatives. So if these groups are actually already doing similar work, then please lean into that. However, if you do find that there are gaps, or if maybe the current structures just aren't cutting it, then that's when you might want to think about creating some focused teams to start handling some of the specific pieces of the work. Here are some key teams to consider, and here's what this might look like in practice. So you could consider a magnet steering committee, which might function as a high-level decision-making body. This team might oversee strategy, alignment, and progress tracking to really make sure that everything is connected and moving toward designation. You might want to pull together a writing team, a small writing team that focuses on execution, helping you really deliver and refine on that magnet documentation. You also might want to leverage a data team that really handles the gathering and validating and some of the analyzing of your outcome metrics, which of course requires some specialized expertise. Again, your professional governance councils could engage frontline nurses in some of the magnet-related projects and work, and this really helps to embed magnet principles into everyday life and practice. You could have department-specific champions. You could have representatives from, say, HR, IT, patient experience, and then some of the specialty units, places like ambulatory or research, etc. So, of course, all of these teams and individuals really bring unique expertise and great information to the table, making sure that really all departments are included in the work and that also they are aligned with the magnet goals.